I think the medication has been more prescribed in the last 20 years because the incidence of attention deficit disorder has increased in the last 20 years.
Family therapist Debbie Brooks regularly diagnoses patients with ADD or ADHD. She says the amount of people experiencing symptoms of the disorder has rapidly increased.
That's something that's a real cause for concern, but we're not really sure why. There's a lot of speculation about environmental factors.
She also has concerns that ADD and ADHD medication may be overprescribed. She says it's very important to have a thorough clinical diagnostic interview with a mental health professional. There are other symptoms that can look like attention deficit disorder, but are really attributed to anxiety disorders, obsessive compulsive disorder, or bipolar disorder.
What we do know is that if it's misdiagnosed, their quality of life is not going to be very good. For instance, if you have bipolar disorder and you've been diagnosed with ADHD, you most likely be given a stimulant medication which could cause you to have more manic episodes.
The American Pediatric Association recently changed its guidelines and recommends the first line of treatment should be cognitive behavioral therapy instead of medication first,
because that actually is shown to be effective to address a lot of the symptoms. If that doesn't work, then you try a stimulant medication.
Brooks believes ADD and ADHD are real disorders. It's a matter of getting the right diagnosis and the right treatment.
You need to have clinical scales given to teacher, parent, and if the child's old enough, to the child, and assess not just are there symptoms present, but is it impacting the quality of 2 or more areas of their life. Not just school, but it needs to affect social, home, some other environment also.
In Springdale, Erica Hall, KNWA, Northwest Arkansas News.